My name is Casey Jones, student ID number 3417644. This is for VTHT 2331, section 31420, fall 2020 semester. And in this video, I'll be demonstrating how to perform an ear cytology, a skin scraping, and a vaginal cytology. We're going to perform a skin scraping, which is used to diagnose external parasites on the skin. We're going to use a location where we believe that the external parasites would be. I'm going to do a kind of mild skin scrape, just a superficial skin scrape on the side of the thorax right here. For a deep skin scrape, you will want to shave the area to get better cells, and you do want to, for the deep skin scraping, continuously scrape the area until you get some of the capillary ooze. But just for the superficial, I'm just going to use my scalpel blade and just do one swipe across the area where I believe that there are the external parasites, and then put that directly on my microscope slide. For this, you do use mineral oil. I'm going to put a drop on my microscope slide. And then I'm going to dip my scalpel blade into the mineral oil. And then I'm going to pick one location and do just one scrape across the superficial layer of the skin, and then dip that back down onto my microscope slide. With our skin scraping sample in the mineral oil now on our microscope slide, it is ready to just place a cover slip and look underneath the microscope just at the low power of like 40 or 10. You are looking for moving mites. For our deep skin scrapings, you are trying to get some of the capillary oozing and potentially some kind of blood drawn, and you're kind of looking for maybe Demodex mites. More of the superficial, you're looking for the mites that are that are primarily living just on the superficial layers and the hair follicles. And you're looking for even potentially some eggs that you could have gotten on the skin scraping sample, and looking for any of the mites even possibly visible then on the skin scraping. On your microscope slide, you might see some skin cells from the scraping. You might see some debris from scraping the skin itself and from the hair. You might find some hair follicles. Doing my scan over this microscope slide, however, I'm not seeing any evidence of mites or external parasites. For an ear cytology, we are inserting our cotton tip swabs into the ear canal in order to identify the source of an ear infection. I am going to insert one of my swabs into kind of down into the ear canal of one. And kind of do a spin and a good wipe out. And then I'm going to do a roll onto my microscope slide, and then I'm also going to do another one. Ideally doing 2 per ear is best. That way we have 2 microscope slides. One would be unstained and one would be then air dried and stained. For our ear swab samples, I've got 2 slides per ear. This slide here is what I have from the left ear. I'm going to fix one with mineral oil and then place a cover slip over top. And for that, I am looking for any possible parasites that could be in the ear that's causing this ear infection or the ear itchiness. And in this sample, you will get a lot of ear debris, even potentially some hair. And for looking at the sample with the mineral oil, I am looking for my moving mites or even microscopic mite eggs. And doing this scan on the lower power, I am not seeing any evidence of mites that are infecting this ear. Our first sample we had performed with our mineral oil looking for external parasites. Now the second sample of the same ear we've allowed to air dry. Air drying is best because additional heat could cause dehydration of the cells, which would make it harder to then be able to ID what kind of bacteria or yeast cells are present. Now that our sample has been air dried, I am going to use our Div Quick solution in order to stain it. I'm going to dip it in our fixative initially. And then into our pink solution. And then into the purple. And then I'm going to rinse this with water, and it will be ready to look under the microscope with our cover slip. Underneath the microscope, now you are looking to ID any bacteria, any yeast cells, and kind of just doing a quick scan through here. On this sample here, I am seeing no problem bacteria. I am finding a couple of our yeast cells, which could mean then that this patient is starting to form a yeast ear infection. This video, we will be demonstrating how to get a vaginal cytology sample. We test the epithelial cells, looking to discover what stage of the estrus cycle the female would be in. We do have an anesthetized patient who is hooked up to our monitors who just had surgery, and we're going to collect the sample today. Initially, I'm going to clean the vulva. I've got some chlorohex solution. And then I'm making sure that because she is sedate, the tail will just hang to the side, but otherwise initially you will want to position the tail that it won't fall forward back onto the sterile field. I've got my sterile swabs. I do need to moisten them then with some sterile water. This is just our sterile water solution. And then I'm going to insert the cotton swab up into the vagina, initially at a very steep angle. And then once you're in a few inches, you can kind of let it relax to 40 degrees. And I'm going to spin it about 2 to 3 times to get my epithelial cells, and then slowly pull out. And then I will go roll this onto the microscope slide. Now that we've got our vaginal smear cytology sample, I'm going to roll it along the slide, getting about 2 parallel samples here, like so. And then I'm going to use our Div Quick solution to then stain it. I'm going to put it in the fixative first for about 5 to 10 dips. And then into the red. And then into the purple. All right. Now I'm going to rinse with water. Now that our sample has been properly stained, I've added a microscope slide and it is ready to look under the microscope. Basically, we're looking for the different types of epithelial cells and kind of how they range and change throughout the estrus cycle. Initially, you'll see in anestrus, which is kind of where we haven't quite started the estrus cycle quite yet, as in where we're not showing any vulvular swelling, non-cornified squamous epithelial cells, pretty decently round. And then as we move forward into proestrus, we're starting to see a little bit of vulvular swelling, and where we're attracting the males but not yet accepting them for the mating process. In this stage, you're going to start seeing some erythrocytes even present. Then as we move into estrus, we're going to see more of the pinkish vaginal discharge, going to start accepting the males for the mating process. The type of cells that you would see are the cornified squamous epithelial cells. You'll kind of start to see them almost folding in on each other. Then the final stage is metaestrus, where we are coming out of the estrus cycle. We're going to see decreased vaginal swelling, decreased discharge, and those cells are kind of then turning into like the non-cornified squamous epithelial cells, and you're going to see a little more debris. Seeing some of those epithelial cells that are kind of folded over each other, which shows that this patient might have been in more of the later stages of the estrus cycle, meaning that she may have recently just come out of heat.
Reviewing the video put on by Casey Jones for her ear cytology, skin cytology, and vaginal cytology. She was very concise with her instructions, very clear on the procedure and also why you were doing the procedure for different things versus the deep versus the superficial skin scraping and the different phases of the vaginal cycle, what you might see on the cytology. Really excellent job.